to think about this model both from a patient's perspective and also from our perspective as clinicians. So let's begin down the bottom left-hand quadrant. So we can see here in stasis, this is low challenge, there's not a great deal of challenge happening, and low support. You don't really have to support the patient. Now for me, in physiotherapy terms, this is sort of itch-scratching physiotherapy. In other words, this is the patient that might come in to see you and you maybe spend 8 sessions with the ultrasound machine, the Placebotron 4000, and all you're doing is chatting with the patient about how their football team is doing, or where are they going on holiday this year. So it's a little bit like going to see a hairdresser. It's all very nice, it's very chatty, you're getting on, you're developing some sort of therapeutic rapport at a very superficial level, but you're not actually really helping the patient. The patient is in stasis. There's no change, there's not a great deal of challenge, there's not a great deal of support. So I want you to think about patients who you've seen who would maybe be in that quadrant, who've had lots of experiences in the past with other clinicians who've been in that quadrant. And think about one word. What one word do you think that patient would use to describe being in that quadrant? Now think about your own personal experience. Maybe some of you have had this experience of being in stasis, very little challenge, very little support, during a learning experience yourself. Maybe when you went on clinical placement as a student physio, for example. My example would be, I once did a placement when I was at university where my educator said, go to the library, you don't need to see any patients, but I do need to know that you've not left early, so come back and see me at the end of the day so I know that you've spent all day in the library. And it was really boring. The word I would use was boring. I was disengaged. I didn't really feel like I was developing in my skills or my knowledge to be able to help patients. So when we think about what it feels like for us to be in stasis, boring is often the word that we see. When we ask patients, what was it like to be in stasis? Often it's boring. Frustrating as well is often what we get here, because we have lots of patients who say, well, I went to see the physio and I'm self-employed, I need money to be able to work, and I had to take time out. Every time I come to see the physio, I'm not able to work, I'm not able to earn money, and I'm disappointed because really all we do is talk about what's on TV whilst they rub me with a machine. I'm not really changing, I'm not getting better. I feel better for 2 or 3 days, they scratch my itch with the magic machine, and then the itch returns, and I have to repeat the same process. So boring and frustration for stasis in that bottom left-hand corner. If we now move across to the bottom right-hand corner, this time the challenge is really low, so we're not offering the patient a great deal of challenge still, but we're offering now huge amounts of support. So this is what we might term cuddle therapy. For example, this might be the patient who is an 85-year-old grandmother, and the last thing in the world that you want to do is to offer them a big challenge. What you really want to do is to support them a lot. So you give them huge amounts of support, you see them on a regular basis, but you don't challenge them. You don't feel comfortable in challenging them because they're a little old lady and I don't want to challenge them. They remind me of my nan. I'm sure some of you will recognise that. Now, the problem, of course, as you can see with this, is this promotes dependency. So when we do this work with patients and we go through this model with patients and ask them about their previous experiences in healthcare, it's this quadrant of confirmation which patients really struggle with, because we have patients quite often who say, the previous healthcare professional, the osteopath, the chiropractor, the physio that I've seen, I saw them for 28 sessions over the course of 12 months, or maybe 3 years or 4 years. And I've developed a really nice relationship with them. I've got to know their children. I buy their kids birthday presents. I make them cakes. So they've built this really strong relationship with the clinician, but they're not getting better because they're not being challenged. They're in their period of sort of having a nice relationship with a clinician, but not really getting better. And that's a key fundamental issue. So from a patient's perspective, often frustration is the thing that takes place here, and a desire to progress, a desire to move forwards rather than staying in this comfortable situation and within this comfort zone.